believe it's 208, 209, and 210 respectively?
Yes. Marked.
Dr. Rodgers, let me first show you, see if these appear, if these are discernible with the overhead. Can you see to what you're referring on the Elmo, or would you like me to approach you with the photograph, Dr. Rodgers?
Yes, it's present on the projection.
And do you have the pointer there with you?
Yes.
And what is the linear opening that you described as shown in People's 208?
In about the center of the stopper, there is an opening from side to side.
Okay, and it's basically a cut or an opening in the stopper going from where you pointed that circle demarcation on the rubber stopper. It's within that circle?
Yes.
Right, and going next to People's 209 to see if this shows it from a different view. Again, can you point out in this picture, although it's a bit fuzzy from the Elmo, can you point out the opening that you've described?
The opening again passes from side to side within the rubber circle.
Okay, and you've indicated again with the pointer going from left to right within the rubber circle. And lastly, People's 210, again, slightly different angle. Does that again show the linear opening going from left to right or right to left within that rubber circle?
Yes.
Now, are you familiar with what a syringe needle, what type of marking that will leave on a rubber stopper such as this?
Yes.
Okay. Did you observe any syringe needle holes in this rubber stopper?
No.
And what is your familiarity, with identifying what could have made this linear opening in this propofol bottle?
We're going to find out right now. Overruled.
I personally have used medical devices that could make such an opening, although I have not used them since medical school.
Okay, what type of medical device, in your opinion, would have made that linear opening on the 100 milliliter propofol bottle?
The medical device is called a spike. So in order to get the propofol out of the bottle, you push a spike into the rubber stopper, and then the propofol will flow out the end.
Okay. Your Honor, I'm going to need to retrieve the whole exhibit. Is this a good time to break?
It probably is. Is it okay with the defense?
Yes, Judge.
Okay. Ladies and gentlemen, hopefully it's okay with you. We're going to take the noon luncheon recess at this time. Of course, please remember and follow to the letter all of the written admonishments as well as my continuing verbal admonishments. We'll be in recess till 1:30. Enjoy your lunch. Thank you. Before the people by their counsels, before Dr. Rodgers once again is on the stand, all the jurors and all alternates are present. To everyone, good afternoon. Good afternoon. Dr. Rodgers, good afternoon, sir. Do you acknowledge you are still under oath and still sworn to tell the truth?
Yes.
Thank you. Be further examination by the people, Mr. Walden.
Thank you, Your Honor.
You're welcome.
Good afternoon, Doctor.
Good afternoon.
Just a couple quick questions. The autopsy photo, people's 206, and just going to the date, were you able to actually look at that during the lunch hour and see that it is in fact dated correctly June 25th, 2009? It's just the angle of the photograph?
Yes.
And I think we ended just before the lunch break with you describing People's 30, the large bottle, and describing that the linear opening in People's 30 was consistent with a spike being inserted into the bottle. Is that correct?
Yes.
All right. And speaking just generally about to identify what a spike is in general terms, looking at People's 157, do you see within this component a spike?
Yes.
And putting this up on the projector just so we all know to what you're referring when you say a spike. Is that this tip here that appears just above the drip chamber? Is this what is known as a spike where I'm pointing here, this tip?
Yes.
And lastly, Dr. Rodgers, do you recall looking at some of the evidence, I believe it was on March 29th, 2011, reviewing some of the evidence that has been recovered in this case?
Yes.
And specifically, did you at that time look at and identify what LAPD item 143 was, which has subsequently been marked People's 120. But did you look at LAPD item 143 on March 29th, 2011?
Yes.
And what was it?
It was an IV catheter with a needle still present.
And did you make observations of that IV catheter to see if it appeared to be used or unused?
It appeared unused.
And did you also look at item 142, the syringe from the nightstand, to see if, and again that's LAPD item 142, the syringe from the nightstand, did you look at that item to see if it appeared to fit and be able to be connected to LAPD item 143, which is People's 120?
I did look at the item, and it did not appear to fit.
Thank you. Nothing further, Your Honor.
Mr. Wogan, thank you. To be cross-examination by the defense, Mr. Flanagan.
Thank you, Your Honor.
You're welcome.
Your Honor, I'm going to need exhibit items 137, 172, and 187. Are they
Are they in the boxes there? Mr.
They should be
Guido?
at the box. Document 137, 187 are in, should be in the box. Dr. Rodgers, have you done anything for purposes of refreshing your recollection before testifying here today?
Yes.
Did you review the preliminary hearing transcript?
Yes.
Did you review your coroner's report?
Yes.
Did you review your notes?
Yes.
How about any expert reports? You review any expert reports?
Yes.
Which ones?
I had the reports from our experts
Who's our expert?
belonging to the coroner's office, the neuropathologist, pulmonary pathologist, radiologist, dentist, and anesthesiologist. I also reviewed an autopsy report that was done after our report by Dr. Robert Lawrence, and I reviewed an examination of items relating to the toxicology in our office that was done by Dr. Pustelnik.
Did you review a report by Dr. Stephen Schaefer?
Dr. Schaefer, I believe, was an anesthesiologist. Is that?
Yes, from Columbia University in New York.
Yes, I did.
You reviewed his report.
Yes.
How about, were you given any reports from outside toxicology laboratories, specifically referencing the stomach contents analysis by Pacific Toxicology and the urine test results by Pacific Toxicology?
No,
You were not shown those?
that's correct.
Okay. Now, in analyzing the toxicology results, you look at the results for midazolam.
Yes.
Those results are consistent with the statement made to the police by Dr. Murray, aren't they?
Yes.
And the diazepam, those results are consistent with the statement made by Dr. Murray, aren't they?
Yes.
And the lidocaine results, those results are consistent with the analysis of Dr. Schaefer in his simulation, aren't they?
Yes.
The lorazepam results, based upon Dr. Murray's statement to the police, they make no sense whatsoever, don't they? Or do they? They are not consistent with Dr. Murray's statement to the police, are they? Oh, no.
And the way this is reviewing his materials.
Well, Dr. Murray stated that he gave 2 milligrams of lorazepam, did you say? Was
2 milligrams at 2 o'clock and 2 milligrams at 5 o'clock.
At 5 o'clock.
Those don't correspond with the .169 femoral vein